Right, so we're going to get onto the mat to start off with, and we're just going to sit down just like so, and we're just going to get the foam roller just in place. So I want you to put the hands here, and all we're going to do is just lean back onto the foam roller, and we're roughly just around the bottom part of the ribs, okay? But we're not on the ribs and we're not on the spine either. So the actual foam roller should be hitting the muscles either side of the spine, okay? If it's not, then obviously adjust yourself so it's doing so. Again, if you've got osteoporosis, don't do this exercise, or don't do any foam rolling, sorry, but you can do the rest of the stretching, mobility and the strengthening stuff, and maybe speak to your doctor about maybe doing some foam rolling and see if that's something you can do if you have that issue. Right, so what we're going to do is we're going to start off by applying a little bit of pressure. We're just going to take the hands around the back of the head, so we're interlocking the fingers and just naturally just let the head just drop into the hands, okay? And again, you might want to bring the elbows slightly together, and just make sure that you're just getting into the back muscles that little bit more, the erector spinae. Right, so from here, we're going to just apply a little bit of pressure, and then all you're going to do is just going to come down or up the back, body coming down, and we're just going to stop at the top of this scapula. So we're not going onto the neck, avoid the neck area, obviously. And then from here, we're just going to come back up. So again, nice and slowly, nice and controlled. And again, you're going to finish off roughly just where the bottom of the ribs are. So we're not going into the lower back. And then we're just going to gently take it back up, rolling the body down. And just take any notes of where you might feel any adhesions, any kind of pain that might be elevated. Again, don't go above a 7 on the pain threshold, but just take note of where it is so you can come back to that at a later date. Good, and then just relax there. So with that one, we're just coming up and down the spine, just nice and easy, or should I say the muscles at the side of the spine. And all we're going to do now is going to go kind of like a side to side motion. So we're going to come to one side and then over to the other side, okay? So that's kind of that rocking motion. Again, you're not going to be rolling over the spine. Okay, make sure that you're on the muscles as we're coming across, okay? So we're going to start from one side. And again, we're going to start at the bottom, roughly, of the ribs, not into the lower back. And then we're just going to come over to one side and over to the other. So again, trying to keep in that same vertebrae. Again, it's nice and gentle, nice and easy. And we just do a couple of rolls here. Then again, you might just want to hold on to the head now. And now we're just going to come in for another rotation. We're just coming up about an inch, so another maybe vertebrae. Again, keeping the pressure off of the spine. Make sure we're on the muscles. And we're getting a nice bit of rotation in. And now we're going to come up again, another vertebrae, maybe another inch, half inch coming up. Getting that nice little bit of a rock in there. Just loosening anything off. Might want to adjust the body just to stay on that same area. Good. Then we're just going to bring the elbows together slightly so we're getting into the scapular part now. So we're opening up the scapula a little bit and we're just getting in there nicely. And again, we're not coming up to the neck with this one. We're just going to come up to the top of the scapula. So again, you might want to move yourself up a little bit more if you've got the space. And then we just do a few more rolls. And relax, nice. So you can do that with a peanut ball if you want to. Again, if you do use the peanut ball, make sure you're not putting any pressure on the actual spine that you are on the erector spinae muscles, okay, on this one. You can use a lacrosse ball as well, that can get in there, but I do find the lacrosse ball can slip a little bit and get onto the spine, so the peanut ball is a better one with that. Again, I'll leave a link below if you want to buy one. For the next one, again, we're going to find that nice little spot roughly at the bottom of the rib cage. And again, we're just going to apply a little bit of pressure, but no pressure on the spine. And we're just going to rock over to one side, or just twist, rotate over to one side. So now the weight is on the left-hand side of the spine, on the erector spinae muscles on that side. And then from here, apply some pressure. It's going to be a little bit more tender now. And then from here, we're just going to roll all the way up. Again, keeping the weight on the left-hand side. And making sure you don't go up past the scapula, okay? Top of scapula. We're avoiding the neck. And again, just make any notes of any kind of adhesions, any areas that are a little bit harder, a little bit more pain maybe. Nice. Good, then relax. Right, nice little breather. I'll work my way down the mat. And then I'm just going to set myself up again. So again, bottom of the rib cage. We're not on the lower back. And then we're just going to rotate over to the right hand side now. And then just apply some of that pressure onto the erector spinae on the right hand side. And then we're going to come up. Again, not onto the neck, stop before we get onto the neck, and then back down. And this is loosening everything off nicely. You might be able to hear the sound of my foam roller creaking and crunching. It's not my back, by the way. All right, so for the next one, just gonna have a little breather again. We're gonna set ourselves up. So again, roughly at the bottom of the rib cage. Again, holding on to the back of the head. So interlocking the fingers. And just let the head naturally relax, so we're not pulling on the neck at all. And then from here, we're going to do like a pin and stretch. So we're just going to arch the back. And then from here, we're going to go into kind of like a crunch, okay? So we're just going to come up and then back down. So we're putting the pressure on one little part of the back. Again, staying on the muscles. and we're just putting some pressure on there. We're pinning it down, and then as we move, we're stretching through those muscle fibers. And getting some nice movement in there. And now we're just going to come up again, up the back, body moving downwards, roughly about an inch, and then we're going to do the same again. So we're just going to arch, and then from here we're going to come up into a crunch and then back. And now we're going to get more into the scapular part. So you might want to just bring the elbows together so the scapula sort of splays out and you can get into the muscles a little bit more. So we're just going to come up roughly about an inch. And now we're going to just bring that arch and then coming up, arch and crunching back up. And again, we're just doing that nice little pin and stretch. It's feeling really nice in this part. And then we're just going to come up the back a little bit more, again another inch, elbows together, and then again arch the back, and then coming up into a crunch. So we're just trying to get some movement in there and really focusing on one area of the back here. Now if you've got room, you can come up another inch, okay, and again not getting onto the neck, so we're staying onto that thoracic spine. And again we're coming into that arch, opening up, bring the elbows together and then crunching up. And then relax, and we're going to get into the abs now. Right, so with this one we're going to be start laying down. So sometimes we could get a little bit tight in the abdominals as well with this sort of kyphosis, bent over upper back problem. So what we're going to do is start by laying down onto our back, shoulders back and down, put the head in that nice position, and then again put the feet on the floor, knees bent, back nice and neutral. And all we're going to do is just use our fingers here and just get into the bottom of the, or the top of the abs, bottom of the ribs, okay? So where the ribs stop or finish, and we're just going to tuck slightly underneath there, and we're going to start where the sort of sternum is. We're going to start in the middle. And we're just going to apply a little bit of pressure in there and then just go side to side. So we're just moving side to side with the fingers and just applying a little bit of pressure. And then just a little hold and just breathe into it and release. Then we're just going to work our way lateral a little bit. So again, you can use 2 to 3 fingers. Get under that rib cage a little bit. Just apply a little bit of pressure, not too much. And then just gently go side to side with the fingers. Just gently massaging underneath the rib cage. And then just apply some pressure, hold there. And just breathe into it. And then a little bit more lateral. So again, tucking under. And then just that gently, just side to side little rock. And then apply some pressure. And relax, nice work. So again, if you feel that you need to, you can go back through that one if you want to. I find that does help just loosen off the abdominals there a little bit if you're a bit tight in that area, and then we can get into the mobility and the stretches a little bit better. So I'll see you in the next video.